We'll start first with Ming Men. So Ming is it can mean, I think it gets translated as like destiny or fortune, but another way of understanding it is in terms of vitality and aging and longevity. And so this part of the spine is an area that is affected a lot by age. So whether you see people that they get calcified in this position or they just have a lot of immobility through their lumbar spine, that you can tell sort of how well a person is aging by how well this part of their spine is moving, because it's a big part in how well are you able to squat, how well are you able to get in and out of a chair. A lot of that depends on how well you can move this area, and mun is gait. And so you'll see the character, it has kind of like two gates like this that kind of open and close. But when you're talking about the spine and you turn the gate this way, it actually is a pretty accurate image of how the vertebrae articulate. So if we think about the location of Du4, which is just opposite the navel between L2, L3, and think of it as a gate that's opening and closing, you can think of it, this is the gate that needs to open and close well in order for us to continue to move well as we age and have flexibility and mobility in the spine. And the front part of this that we're talking about is Ren 4, which is level with the ASIS. And this Guan Yuan, so Guan is a character that can, it's often translated as mountain pass, but it's also as the bar. So in those old doors, so we have still continuing with the mun, like if you have a gate, the big bar that you put across it is the Guan. And so when we talk about pulses, often it's translated as the bar pulse, referring to this bar that's closing the gate. And, you can see validity for both of those. And Yuan is like the source of, kind of the mysterious source of life, right? So it's our source chi, or the kind of place of vitality in the body, and that a lot of the magic happens here. This is where babies are held, and reproduction and stuff comes from here. And so it's also a place that as we age, the capacity of holding this area in is often diminished. And so I think, at least the way I understand it, Guan Yuan, it's about how well you're able to hold in and contain the vital organs in your pelvis. And that happens, a lot of it we call now transverse abdominis activation. So, obviously it's more than that. It's not just how tight that is, but in terms of anatomical reference points, it's fairly useful. So if we think of mobility of this L2, L3 junction, and how well is this transverse abdominis, which you can, obviously it spans the whole abdomen, but where you really start to see it weakening, especially in women postpartum, is through this lower abdominal area. So we're going to do just a few movement explorations with that. So take one hand and put it around your Ren 4 area. So if you are new to this, the heel of your hand goes on one ASIS and kind of drop it over and then slide it so the center of your palm lines up with your navel. And then the other one, kind of just turn it so your palm is out so you can relax your shoulders and find the L2, L3 junction, which is right behind your navel. So if you don't know where that is, just take your navel, go to the back, and then hold it there. And so what I want you to do is, we're going to explore just some gentle, let's just look at the terrain first. So even though you have the back of your hand here, you can hopefully feel the vertebra, feel the kind of bony surfaces of your back, and then feel how that is the similar or different, probably different than what you feel on the front. And so this lower abdominal area, you should feel that there's some muscle tone here. Underneath the muscle, we have the intestines and then the bladder and the uterus down here. So we have kind of this kind of like soft, muscular, rounded shape in the front, while we have a vertical, bony, articulating surfaces in the back. And so let's explore the relationship between those two things. So as we gently articulate the pelvis, so how that happens is I want you to drop your tailbone. So you're going to feel a lifting up from the pubic bone so that the lower back kind of gets flatter. So you should feel a flattening through the backhand, an engagement through the lower abdominal muscles as the pubic bone comes forward, tailbone drops down, and then explore the opposite. So now you should feel an increase in the curve in your backhand, a dropping of the pubic bone down towards the floor, and an increase in the arch. So from here, let's just kind of move back and forth and start to feel the relationship between these two places. And start to feel like, at what point do you feel more activation through the front? What point do you feel less? And now we're going to explore it in conjunction with the breathing. So we're going to start just as you breathe in, have a little more curve in the back, breathe out, drop. And at the use kind of the end of the exhale, breathing out, push out the air, and kind of feel how that helps have a gentle contraction through the lower abdominal muscles. And then just continuing at your pace of breathing. I'm talking, so I'm not going to be as in the same pace as you. So you breathe in and breathe out. Okay, and so feeling how you can coordinate those two movements of the pelvis. Well, actually, it's the whole spine, because when you're moving the bottom part of the spine, the top part of the spine is moving as well. And then try it with the opposite. So kind of notice how now I want you, as you round the lower back, pubic bone comes forward, breathe in, feeling how you're compressing through the front, right? So that breathing is actually going to come more into expansion of the ribs into the backhand. And then breathing out, you're contracting the lower abdominals more in this extended position. So try a few rounds like that. And you'll notice that this is much more muscular and a dynamic way of doing it, because we're not really used to breathing back here. I mean, most of us. And so to really contract through the front to allow the breathing to go more into the back is going to feel a little bit different than when you have the breath in the first way that we tried. And then same thing, breathing out. And then that exhale, the lower abdominals naturally come in, hopefully, as you're breathing out and using those lower abdominals to help push out the last bit of air. And so activating them in extension or with this curve in your back is going to feel a little bit different and probably a little more muscular. And so this relationship is essential in kind of the health of the lower back as well as in the lower abdominal organs. Because if this is clenched too tight, it's going to lead to a lot of stagnation through here. It's going to lead to an immobility of the lower spine. And if it's underactive, then instead of having support from the front for the spine, the muscles of the back are working all the time and they never really turn off because there's underactivity through the front. And so kind of keeping your awareness of these two places, doing simple things, whether it's like kind of coming in and out of a chair. So if you kind of feel coming into this like a sitting position here, so I'll turn for the front. So you want your thighs kind of feet hip distance apart. And as you're coming into this position, you should start to feel a support, like a curve in the lower back, but then also a support through the front. So in this position, if you're feeling like, oh man, I'm really using my spine a lot to come into this kind of half squat or half seated position, that probably means you're not supporting enough through the front. And so you can play around in this position to feel like, how much do I need to engage through this Ren 4 area, the transverse abdominis, to allow the lumbar spine to be supported without this overgrabbing in the paraspinal muscles. And you'll start to feel this relationship between how the engagement through the front of the body allows for greater mobility through the spine, and it also supports so that the muscles of the spine aren't having to kind of hold and do all of the articulating of the spine, that it should actually be able to come from the front as well. And one other thing you can try to be able to feel how the kind of movement of the pelvis, of which I'd say these are kind of the two kind of ringleaders of that motion, affect the rest of the spine. And so if you imagine like a broomstick going through the trochanters here, and that you're just moving your pelvis on that kind of along those horizontal axis here, and then start to notice how the rest of the spine is responding. So you can put one hand on the chest, so it'll do another important place, red 17, danzhong in the chest, and the other one down here. And so we're going to, similarly with the shoulders, we're not going to come forward. You're going to stay in a relatively vertical axis and articulate from those two places. So I'll come this way so you can see me from the front. So without leaning back or forward, staying relatively upright, I'm going to take my hands further apart and take my hands closer together. Taking my hands further apart, taking my hands closer together. And then from the side, you can see more of how I'm articulating the spine. So I'm taking the hands further apart and bringing them closer together. And feel how you want to keep some activation through this lower hand the entire time. Because if you totally turn this off, then you'll start to get the extension only coming from the muscles on either side of the spine, and they're going to get fatigued and sore and tired. So you want to try to keep the support through your front hand as you're articulating the spine, and noticing the tanzhong area is raising up, coming up towards the chin, and then dropping down. Okay. And then our next one will explore some other landmarks in the upper part of the body.